Okay, good morning and welcome to Coffee with the Commission, a time where the WMC discusses topical issues that affect you. Today we will be discussing discrimination in a healthcare setting and how to file a discrimination report with the Medical Commission. I am here today with Mahi Zeru, Equity and Social Justice Manager with the Medical Commission. Mahi is going to give you an overview of this topic, and then we will have time for discussion and questions. Feel free to ask your questions along the way by using the chat function at the top of your screen, and we will address those questions after the presentation. Please understand that we cannot discuss open investigations and cases in this forum. Before I turn the webinar over, I'm going to take care of a few housekeeping items. We are recording this webinar, and it will be available on our website within the next few days. So please feel free to share these resources with your friends and colleagues. And also remember to stay muted unless you're speaking, and if you're having trouble with sound, use the mic down arrow at the top of your screen to adjust your settings. Now, with all of that out of the way, I'm going to turn it over to Mahi.
Thank you so much, Jimmy, and thank you all so much for being here today to participate in our Coffee with the Commission. And like Jimmy said, Coffee with the Commission is the Commission's way of connecting with residents of Washington State to share helpful information. Again, my name is Mahi Zeru, and I'm here today to discuss and raise awareness about healthcare discrimination. I'm here today to talk about how discrimination impacts us and ways we can address it. And if you have experienced discrimination and would like to file a complaint, I will also tell you how to do that with the Washington Medical Commission. Here at the Commission, we work to ensure patient safety by making sure the medical doctors and physician assistants in our state have the right education and have passed all the right exams to become fully licensed practitioners. And we also discipline and help educate providers to improve their quality of care. We also work to establish policies, rules, and also educate the public on different topics. So today, I'm excited to share an important topic. So let's get to it. So what does discrimination mean? Simply put, it means unfair treatment because of the way you look, talk, or move. And discrimination in healthcare is when a person or a group is treated differently because of a preconceived ideas about one's identity. And according to a study published in the Journal of American Medical Association, 1 in 5 adults have experienced discrimination, which means, again, a lot of people are being treated unfairly. And 5 of the most commonly reported types of discrimination were based on race and ethnicity, education, income level, or weight, sex, and age. So what does discrimination look like? Discrimination can look and take many forms and is present across all medical specialties. Discrimination healthcare settings include providers dismissing a patient's symptom or health concerns, offering different treatment based on the patient's type of insurance, or not ordering diagnostic tests and procedures. Discrimination in healthcare occurs due to many factors. Discrimination might happen due to providers' implicit or explicit bias. Implicit bias is an unconscious thought that is present in society, a thought that comes to your head when you think of a group of people. A good example could be when you think of babies. If you like them, they're super cute. If you don't, they're loud and needy. In society, what you think might not be a problem, but in the doctor's office, it might cause a problem. An example could be women reporting pain. The provider might unconsciously dismiss pain because he thinks all women exaggerate pain. And that leads women not to get referrals and to further investigate the cause of pain, which delays treatment. And God forbid, there is like a tumor, if your primary care provider dismisses all of your concerns because he thinks you're exaggerating, then the tumor will spread, and your outcome and your treatment options also decrease. So that's implicit. And explicit is overt expression, making racist comments, sexist comments, homophobic comments to patients. So that's overt, and you can tell somebody's being explicitly racist or biased. Another contributor is structural system barriers, such as the insurance system, paying for certain procedures. Cancer screening is available at a certain age when we know the risk increases with the type of work you do or your work or family history. Um, Language and culture is another contributor to this unequal treatment. A patient might receive um, from their hospital or clinic. If you can't communicate with your provider your symptoms, then you're not being provided, because you're not being provided with interpretation services. You may have to rely on family. And culturally, there are certain things that you don't want your children to know, or your family to know. Things such as family planning, birth control is off limits. It's off limits in some cultures, and for that you speak with family when making medical decisions. And this is a list of discrimination types, and this is not an exhaustive list. This is available in our complaint form, and this is not an exhaustive list, but these are some of the discrimination types that we see frequently. To highlight one, age discrimination, also known as ageism, is when a patient is being treated differently. For example, a 65-year-old man reports pain, and his provider dismisses pain and says it's a normal part of aging. Patient comes in again and asks for tests. Then, provider dismisses the symptom and says it's a normal part of aging, and then, this happens a couple of times. And then the complainant finally goes to the emergency department where he learns that he has cancer. Maybe, his provider has listened to him instead of looked at the number, on the chart, his age, maybe he would have better outcomes and less invasive treatment options. So that's an example of ageism. The impact of discrimination is vast. On individuals, it causes us to become sicker and die younger when compared with groups who do not experience discrimination. And data shows that African Americans have higher rates of chronic diseases, such as heart disease, stroke, and diabetes. And Native Americans have higher rates of infant mortality and tuberculosis, and Hispanics have lower rates of cancer screening and vaccination coverage. So these are all disparities. And discrimination in healthcare can have significant psychological and emotional toll. It could cause depression, anxiety, and even suicide. So people who delay routine care often end up seeking emergency care for more serious complications, which is typically more expensive than preventive or early stage treatments. So this is all an impact of discrimination. And after we talk about all the types and forms of discrimination, you're probably thinking, is this legal? Is there nothing we can do? And there are legal protections against discrimination. And there are several agencies making sure healthcare facilities are accessible and people's rights are being respected. Title VI of the Civil Rights Act of 1964 prohibits discrimination based on race, color, or national origin in programs that receive federal funding. And Section 1557 of the Affordable Care Act makes it unlawful for any healthcare provider who receives funding from the government to refuse to treat an individual. And there's also the ADA, American with Disabilities Act, which is a federal law that protects people with disabilities from discrimination. And here at the Commission, we have a discrimination healthcare policy that protects people from discrimination. Washington Medical Commission's policy highlights discrimination as a violation of a standard of care, and it also highlights it as a unprofessional conduct under our UDA, which is the Uniform Disciplinary Act. There are a set of laws that govern licensure and discipline for all healthcare professionals. So it's a violation under that. And most importantly, it connects discrimination as a key determinant of health that leads to healthcare disparity. So after investigation and if there is evidence of discrimination, uh, Washington Medical Commission takes action based on the nature of discrimination that I explained earlier. So if it's implicit, if the provider discriminated because of implicit bias, meaning they weren't aware that it was totally unintentional, action would be education. So the provider learns and makes sure that it doesn't happen again. But if it's intentional and explicit, it could go all the way to suspension of license. So if you feel that you have been discriminated, and so this is how you filed a discrimination complaint. So first, you have to gather the information. You have to have your contact information. You should also collect the healthcare provider's details, the dates and location of when it happened, and also be ready to explain the reason for the complaint. Um, and you get the complaint form by going to our website, washingtonmedicalcommission.wa.gov, and you fill out, and we have a paper form, and also you can also fill out online. The online version is much easier because you can just submit right there. But if you choose to print a copy, you can mail it at this address. And translated complaint forms are, in addition to English, they're available in Spanish, Vietnamese, Russian, Marshallese, Ukrainian, and Chinese, simplified Chinese. These are the top 6 languages spoken in Washington. Um, and if you have a complaint that you've written in a different language, for example, Arabic, we do have the ability to translate that and get it to our commissioners for review. So if you have any written complaint, please submit it and we will review it. And this is what our complaint intake form looks like, the nature of complaint. So discrimination is right underneath the charting irregularities under in our paper form. Online version, when you click discrimination, it breaks it down further and asks you to check a box that fits your complaint. For example, ageism, all of the types of incidents that you saw earlier are listed, and then you can also explain further in the other section. And we only process complaints that are written. So if you're unable to type or write your complaint, we do have a reasonable accommodation we can provide you. So if you have a disability, physical or mental, if you're unable to type or write in any way, uh, call our customer service and at this number, 360-236-2750 from 9 to 3 p.m. and we will get that accommodation set for you. And you probably want to know what happens after you file your complaint. Within 3 weeks of submission, your complaint gets reviewed by 4 commissioners, 3 medical and 1 public member. And if your complaint is authorized for investigation, meaning there's evidence of discrimination, an assigned investigator will contact you. And at that point is where they get all your medical records, so you don't have to worry about that, and they will do the investigation for you. And and after that, the commissioner panel will meet to discuss your case, and they will decide if it will result in a disciplinary action or a unique type of closure. If your complaint is closed and you want the commission to reconsider, you have 30 days to submit new information. And that is all I have for you today. Thank you so much for being here. And if you have some questions now, would be a great time to ask. Thank you.
I hope all of you will join me in a virtual round of applause for Mahi. Thank you so much for a wonderful presentation. Like Mahi said, Coffee with the Commission is a time for discussion. So please feel free to turn on your cameras, but remember to stay muted unless you're speaking. If you're a little shy this afternoon, that's okay. Please feel free to type in your question or use the raise hand function at the top of your screen, and we will answer your questions and have the discussion. So while folks are typing or getting adjusted to the Teams environment, Mahi, I'm just going to ask a clarifying question for everyone. If you have a written complaint in a different language, how do you get that to the commission?
You can either mail it to us at this address, not this one, this one. So Washington Medical Commission, the PO Box, or you can email it to us. And the email is medicalcomplaints@wmc.wa.gov. I can also type it in the chat.
Thank you. Does anyone have any questions or topics for discussion with Mahi? Okay, well, seeing none, I can end our coffee with the commission. I'm going to put our contact information into the chat in case you think of something later. You can always reach out and we can assist you further. But I hope you have a great day. Thank you, Mahi, for presenting this valuable information. Thank you, everyone, for attending. Reach out if you have questions. We're here to help you, and I hope you do. So have a wonderful week, and remember to take care of yourselves. Thanks, Mahi. Have a great day.
Thank you so much, everyone. All right, bye.